Hi guys, good evening. It's me again, Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adult and Physiogen PT and Wellness. All right. So it's another, thanks God, it's Thursday, another physical therapist, academician, entrepreneur, global therapist that we usually highlight in our Balance and Fall Support Group. So it's Physical Therapy National Physical Therapy Month and also Falls Prevention Awareness Day. So we are so glad that for today we have Dr. Shanelle James. Dr. Shanelle James is a physical therapist, doctor physical therapist, and certified recreational therapist is specialist. So something unique, right? So we want to make our physical therapy session fun, and she will tell us more about that. She's the owner of the LimbsNThings LLC, based in Washington, D.C., is a mobile physical therapy and telehealth. And without further ado, we have Dr. Shanelle James. Hi, Dr. Shanelle. Good
How are
evening.
you? Good evening.
I'm good. Thank you so much for this opportunity. We appreciate your time. I know you're very busy. So
Thank
tell
you.
us more. Yes, you are welcome. So the limbs and things, that's really unique name. We know the limbs, but what are the things, you know?
Right.
So we'll give the floor to you. Thank you so
Sure.
much sharing these things tonight.
So limbs and things is all about not just your extremities where we think your arms and your legs, but also what connects us. So our spine, all the things inside of us that make us who we are, our mind, all of our nerves, and all of the ways that that connects with your muscles to help you to move.
Yeah, it's National Physical Therapy Month, Dr. Chanel. What do you love most as being a physical therapist?
Mm. I love working with people. I like the variety. And as physical therapists, we can work in so many different settings. And I have worked in quite a few, but this one, being mobile and seeing people in their natural environment helps me to help them to be the best that they can be where they are most of the time.
Yes, yes. And how many years now you're working as a physical therapist? I know you're based in Washington, D.C., but the Limbs and Things LLC covers the Virginia and Maryland. So tell us more about it. Are you more on aging adults, like the majority of us, geriatrics, or also peds?
So I am mainly Asian adults.
Ah, okay. Yes, yes.
Mhm.
And is it more on the tri-state? So, how you're able to cover that? It's a mobile PT, but maybe because of telehealth?
Right. Telehealth as well as mobile. I just try to, of course, schedule it so that we aren't traveling in all of those areas every day. But being able to, a lot of in this area overlaps. So DC and Virginia, you can see in the same day. Some parts of Maryland, you can see in the same day too. It's not so spaced out because we're a small area.
All right. So is it
Yeah,
more on you're driving more or you do more on
I'm
telehealth,
driving more.
Dr. Chanel? Oh, okay, okay.
Yeah.
And then is this like we know the mobile PT can be like Medicare, we can be like cash based. How's your setting, Dr. James?
So we're both. We do Medicare B and TRICARE in terms of insurance coverage. And we also accept private pay as well because we have wellness services too.
Yes,
Yep.
yes. So the limbs and things, knowing that you are a certified recreational therapist specialist. So I'm sure what makes you different from the other therapists that we have?
I guess as part of my evaluation, I always want to find out what someone likes to do, not just what they want to do to be better in terms of their movement, but what have they not been able to do that they used to do that's fun for them. Like some people want to get back to being able to bowl. Some people want to get back to being able to shoot pool in their home. And like one patient I have right now, that's our goal. And so we're working on balance control so that he can do that post stroke.
Oh, that's really good. That's the
Yeah.
first thing evaluation. I like that, especially for our clinicians, newbies, and especially goal setting is very important during eval, right? So you base
Absolutely.
automatically your functional treatment on the goals that they wanted. All right. And what molds you? What motivates you to do these things like aging adult? Why not like sports? I keep asking that. Why geriatrics? What is it with them?
I think our personalities resonate the most with one another. I like their schedule too. They don't like getting up too early. They don't like hanging out too late. So therapy is right in the sweet time, and having children, that kind of works to my advantage, doing it during the day. So I just enjoy working with them. There is always lessons learned, not just me teaching them, but them also teaching me as well.
Yeah, we learn from them a lot, right? They are the golden
Definitely.
years. And then we have certain characters that we need to have when we are treating with the geriatrics. What do you think are, just give us three, like if you are a physical therapist and you're looking forward to treat our aging adults, what do you think are the three characters that you must have? At least just give three. Yeah.
Sure. So respect, I think, is high on the list, as well as patience and understanding. I think there's a lot of times that we have an idea of what we want them to do, but then we have to understand all of the ways that it may take for them to do it. Is it going to take them a long time to get dressed? Is it going to take them, time to get acclimated to what you're asking them to do? Are they processing what you're wanting them to do? There's so many different factors that go into it that are kind of psychosocial more than physical.
Yes, and the compassion, like what you said,
Absolutely.
understanding, right? Yes,
Mhm.
it's really important. And then as a physical, how many years are you now, Dr. Chanel? How many years as a physical therapist?
10.
Wow. And then on your 10, can you give our clinicians listening right now some of the books, your favorite books or courses that molds you to be a great clinician you are right now that you can
Mm.
share?
I think I just took a balance course. Um, I forgot the actual name of it, but the goal was to look at the whole person, but taking it from more of a basic level in terms of balance, how we always think we should start with a person sitting, but taking it back to them laying down and using that for every person, regardless of where their function begins, and looking at their ankles to see their balance control as opposed to like a whole system review. Because there are a lot of different things that we can tell from someone's feet, of course, in terms of their control.
Yeah, you're talking like an anatomy train, right? Yes, yes. Because sometimes we keep saying, "Oh, I have a pain on my hip." And then when we check from the bottom, the ankle has the problem, and that's why it
Yeah.
just referred to the knee. So the foundation,
Mhm.
definitely. That's a
Yep.
good tip too, as a whole for all the clinicians listening. And how about books that you love? Even it's not like medical, anything like psychosocial or psychological that really motivates you or mold you to be a strong person that you are.
I guess the best book for me that I read on a regular basis is the Bible. Nothing necessarily that's, I guess, mainstream, but it just helps me to get my mind together before I go see someone else.
Yes, thank you for sharing that. I see also sometimes your TikTok and all those things. Sometimes I love your videos. That's
Thank
why I didn't know you're a recreational therapist specialist.
Yes,
That's why you build and put more fun, like music.
yes.
Um, for my treatment, I just do more on music therapy and I play music. I
Hmm.
always incorporate dancing
Yes.
in those things. So that's really good because I see some of those too. Love your ideas. So if you can give us some tips for our balanced and false clients. The clients and caregivers, we just had the False Awareness Prevention Month. So we always want to observe it, not only a month, right? So what
Right.
every time, every day. So any fall prevention tips if for our clients and caregivers listening right now, Dr. Chanel?
I think we always look at someone's home, but one possible factor that we don't harp on is the lighting in their house. If a person doesn't necessarily like having their blinds open, but it's difficult for them to see, or they're finding that they're tripping more, not necessarily falling, because a near miss is still something you should work on. But vision, especially if the person is having issues with their blood pressure or any other vital signs, just making sure that their vision is still optimal for them to operate in their home safely.
Yeah, and also we have a wonderful, I did a fair resources in the CDC, Dr. Shanelle. They're giving away brochures and they have what you just said, the home modification and that checking the vision, checking the lights. That's really good tips. All right, guys, you listen to that, huh? Home modifications, especially our colleagues, occupational therapists are doing that too. They're very specialized with that. How about any tips for our balance and falls, any clinicians looking forward to be like their niche is geriatrics, you know? So, any tips for them?
I'd say make sure that you actually love working with older adults. If you don't, they may turn you off initially, just because there are some people who are set in their ways and they make comments that are not as mainstream. And so you have to know how to navigate those. And being respectful of that person may be a challenge if you're not familiar with how they speak or how you guys can communicate.
That's true. Cultural thing is very important,
Absolutely.
especially like me. I was not born here, you
Mhm.
know. And then we Filipinos sometimes we are sensitive enough. Sometimes our clients are saying something that they didn't mean, but they're natural for them, and we
Right,
might
right.
we might think it differently.
Mhm.
And then there are many others, but we need to know, we need to adapt, and we need to improve. That's why
Mhm.
we need to be cultural diversity or involved and also learn more. So that's really
Right.
good thing. Really good tip there. And how about if they have challenges and wins, what do you remember are your challenges? And of course your wins as a mobile therapist or as a physical therapist as a whole, Dr. Chanel.
Sure, there are always going to be challenges. I think the main way to get through them is possibly talking to someone who's in a similar situation as you, especially if you have a moment to step away from the situation so that you can think about how to make a change the next time it comes about. Wins would be just seeing people reach their goal. With limbs and things, the whole purpose is to move from you can't do something to being able to do it. And hearing, like, one of my patients told me, I went to the movies for the first time in a long time.
Yes.
And, you know, just having that opportunity to get back into the environment and doing the things that they once thought was something they wouldn't be able to return to doing, that just brings me inner joy, of course, seeing them reach that goal.
That's really good. You're part of their goal and they will not forget you, you know?
Right.
That you're that, oh, that's the therapist who treated me and we were able to do like that. And that's always strikes you. And whenever they always ask, do you have any special like cases or physical patients? And that's always hits you. Oh, this
Right.
one is the pain. Yeah.
Uh-huh.
So, and any stories like that? What's your exact story about that particular win? So tell us more about and how did you treat that? What kind of balance or some modification you did for her or him?
That person actually has uh, a different lung diagnosis. It's called J2, I believe. They're not sure what it came from, but it's an autoimmune disease that attacks your lungs. And it has actually not just attacked her lungs, but everywhere. And so she's swollen in some areas, and she was taking prednisone, and they reduced that. It was a lot of coughing and more endurance issues, making that trek outside of her home more cumbersome. And so we worked to improve her endurance, but then it also started affecting her joints. And so we've had to work around knee issues where it was difficult for her to stand. And so now she's able to walk around her house and walk out of her house to her car. Longer distances do require that she use a device. But just the fact that she was willing to go out with this oxygen machine that she has to take with her, but she's been able to secure a portable tank now so that she can leave her house and feel comfortable to do so. Yeah.
Oh, wow, that's really good. Yeah. So they met their goal, and then, and how many, like, is it a month in this particular client to improve and reach your goal? Like a
This
month or so?
was probably about 3 months, and we were only
Mm-hmm.
meeting once a week. So over a
Oh,
course of
wow.
3 months,
Yeah.
one session
Aerobic.
per week. Hmm.
Aerobic conditioning is really tough, especially this is
Yeah.
a respiratory disease. It's always like longer, a little bit chronic.
Mhm.
Yeah, that's really good. Kudos to you. I just remember mine is like it's more on joint related. She had a
Yeah.
fall and she's so now high fear of falls. So everything she does, she will not do. And that
Hmm.
restricts her movement. So all her trust, all
Right.
her confidence are gone. And then
Hmm.
and her goal is just to put her bra. I said I will send an occupational thirst to make it faster because I'm physical thirst. I focus on your balance. No, no, no. She just want only one, only PT, so not too much. All right.
Yeah.
And then we're able to manage it by
Hmm.
doing some taping, a little bit of joint mob, mix. I focus more on her goal because that's her goal, right?
Right.
But luckily, she was so happy and by just doing that. But psychological makes a big factor.
Absolutely.
Once they have a fall, you just need to dig deep so they will be more involved, and I cannot get anything from her. She will not participate with me because she's so afraid, right? I
Yeah.
really love those stories. So thank you so much for sharing those, Dr. Shanelle James. If
Sure.
you will going to give us like a reminder to all the clinicians wanting to have their own mobile physical therapy or telehealth, what's your advice?
Mm. If you would like to be a mobile therapist, I think you should have a mentor, someone who's walked this path before, who can show you the ropes. I did have that. But even still, when you do, you got to have the drive to continue to go on because it can be a lonely road. You don't have coworkers.
Mm.
You don't have someone who you can bounce ideas off of. But you do have the support of that mentor as well as your drive to be able to help those who you're serving. So I would just suggest that if you really want to do it, that you buckle down and really consider all of the factors that may be involved and getting with like-minded people to help you who've been in your shoes.
All right, that's good. Why we're going to do a certain and make it more difficult for us, right? Those
Exactly.
mentors are coaches. I think we have the uncaged clinicians.
Yeah.
I think that's what you want to also coach. Shout out to Coach David,
Yes.
Captain David. All right, and also we have many mentors out there, and also um and then they are three now. We really appreciate you guys. And the mobile PT roadmap. So that is also F Scott and everybody. So guys, that's really correct, Dr. Chanel. Our coaches, our mentors, they already knows the what are effectives and the loss.
Yeah,
So they
exactly.
will guide you. It's expensive, of course. You're getting a coach, right? But even the NBA needs a coach.
That's
All
true.
right. Yeah. All right. Last thing, what's your favorite exercise that you always do for our clients? Like anything that this is the best one. I always include this, although all of us are always different. So what
Hmm.
you think you always include on your exercises?
So I always include an aspect of balance control, whether the person is seated or standing, having them to close their eyes just to see exactly how much vision is affecting their balance, as well as to see if they have proprioceptive control. The person usually is a little fearful, and if they are fearful, it tells me a lot more about their balance than the actual movement. And it's just interesting to see people's reaction because that tells you a little bit about them and their trust of you. as well as their abilities. So I think it's a twofold exercise to have them close their eyes and try to balance themselves.
Yes, yes. Yeah, balance exercises are really part of your session all the way, guys. Strengthening, resistance training, balance exercises goes hand in hand so we can have improve their goals. All right. Thank you so much, Dr. Shanelle James. Thank you for
Thank
all
you.
your contribution to our aging adults. And I know you're also the Secretary of the American Association Physical Therapy. So tell us more, what's your responsibility for that? Thank you for your service.
Thank you. So the American Academy of Physical Therapy, I am the secretary of it, and we work toward helping students to get into physical therapy school and physical therapist assistants as well, making sure that they have the support needed for successful entry as well as graduation, but also helping those clinicians that are in faculty positions, those of us that are just in private practice or working alongside others to have people who look like you, but also have the opportunity to present at different events and conferences that we have. And we just had a conference last weekend.
Oh, congratulations. Thank you. Yeah, if you need help or any mentors or any, what do you call that, speakers, we will gladly look for that and we will coordinate with you. Just let us
Oh,
know.
great.
So
Thank
that's
you.
really good. That's for the physical therapy students, and then we would love to collaborate. We're more on, we would like to have all clinicians learn more and at the same time learn from everybody, right?
Absolutely.
Teaching, mentoring. All right. Thank you so much. If you have any questions, guys, connect with Dr. Shanelle. So Dr. Shanelle, how can we connect with you?
Oh, so you can reach Limbs and Things at www.limbsnthings.com. We're on Facebook and on Instagram and YouTube at Limbs and Things LLC. And on YouTube, it's Limbs and Things.
Yes. So that's easy to remember, limbs and things. And then N is really N. All
Yes.
right. So she always involved music and therapy. So if you love music, what moves you? What's your exercise? Is it more dancing? What makes you move?
I like whatever the patient likes to listen to. I find if they like the music, they'll move more. There's one patient I have, she doesn't do anything without listening to Earth, Wind, and Fire or Michael Jackson or Prince.
Okay. I just have one always. I want to dance with somebody by Whitney Houston.
Oh,
It's
yeah.
just automatic. I want to dance with somebody, and then
Uh-huh.
automatic seated exercise, all the beat. If you can hear the beat, right? It's
Exactly.
easy. And then automatic. She will just copy what I do, but the tempo of I want to dance with somebody. And the good
Uh-huh.
thing with YouTube, sometimes it will be
A loop.
all
Yeah.
fast songs secondary. So all the 80s will be there. So
Mm-hmm.
thank you so much, Dr.
Thank
Shanelle.
you.
We really appreciate you. Your service for the academy, your service for our aging adults. I didn't know you also have your time to volunteer for our physical therapist students. And thank you so much. If you have any question, guys, and would love to connect and ask more about your experiences, her wins, and her journey, connect with Dr. Shanelle James in LimbsNThings. All right. Thank you so much, guys. Thank you, Dr. Shanelle.
Thank
All
you.
right. Thank you, guys. Connect with us with Vision PT and Wellness and Balance and Fall Support Group. Again, I'm Dr. Jenny Yusuf, physical therapist, doctor of physical therapy, and the vice chair of the Global Health in Aging Adults. All right. Bye for now. Take care. Thank you, Dr. Shanelle.